So why I chose to be a dentist, it was a combination of wanting to be in healthcare, wanting to be in a career where I could get into business. And with dentistry, you're in healthcare, you're treating patients, but you can also start up a practice and own a business and grow that business. So the merging of the two, being in healthcare, being able to own a business, that was very appealing to me. One of the things I feared about becoming a dentist was whether I would truly enjoy the work. It's all good going on work experience, reading up about dentistry, but you never truly know whether you're going to enjoy it until you start doing it. And in my first year of dental school, it wasn't that enjoyable, but when I started now getting to treat patients, see patients, that confirmed to me that I'd made the right decision. So yeah, that would have been my biggest fear, the fact that I was never certain whether I would truly enjoy dentistry as a career. I looked forward to having the opportunity to be able to change people's perspective of dentistry and dentists. That's something I looked forward to, being that dentist that was able to make patients feel good about going to see their dentist, and about the service and the care they received from their dentist. So that's what I used to look forward to. In my experience so far being a dentist, that I am seeing that transformation with my patients, where they come in being anxious, nervous, and after I've spent time with them, appointments with them, they're leaving transformed and not fearing the dentist. So I'm really enjoying that and seeing that come into reality. One of the patients that I recently saw works for the police, and he was telling me that he will easily face a guy with a knife trying to attack him, but when it comes to the dentist, he's really anxious about that. But even when I numbed him up, he didn't feel a thing. He was really surprised by how painless the whole procedure was, and even from that one initial meeting, I could tell that he had already started to turn the page and becoming more confident about visiting the dentist regularly. One of my worst experiences so far as a dentist, I would say, when a patient I was treating, I was straightening his teeth, improving his bites. He had a severe overbite, and we had straightened his teeth, we had improved his bite, but he had become so obsessed with trying to get a almost unrealistic result that finishing that treatment wasn't enjoyable, and really got to the point where I wasn't looking forward to appointments with him, and I was just wanting to get it finished and done with. But interestingly enough, after I finished with him, he referred his daughter to come have her teeth straightened with me. So that sort of made me feel better, in that he actually did like me if he was going to send his daughter to come have treatment with myself. But I remember when I was treating him, it just got to the point where I felt like, this is not really enjoyable. Whenever I see his name in the diary, it's a heart sink moment. But it turned out well in the end. Getting sued is one of the biggest stresses of being in dentistry. Fortunately, I haven't gotten to the point where someone's reported me to the GDC, and hopefully it stays that way. I do think if you look after your patients, not just clinically, but on a human level as well, so really caring about what they're saying, listening to them, respecting them, taking time to answer them, make sure they understand what's going on. I think if you spend that time with your patients will come to like you, and they won't really ever get to the point of suing you, even if something goes wrong. People don't sue people they like. So I think if you focus on that, a holistic approach to patient care, you shouldn't really worry about being sued. And if any issues arise, issues will always arise between the treatment and expectations, as long as there's local resolution. So being able to sort it out at the practice level, again, there should be no fear of getting sued. So it is a big fear for dentists. I mean, dentistry in the UK, dentistry within males, high suicide rate. So there's a real stress there within dentistry. But I think if you spend the time with patients and treat patients that are able to work with you, then I think you should be fine in your career. One of the things that surprised me most as a dentist was the fact that you being self-employed can be a good thing at times, but you need to learn how to manage it. So, for example, knowing that you only get paid on your activity. If you don't work, you don't get paid. And at times of the year, there'll be times where you do a lot of high value treatment, so you earn a lot. Being able to handle the months where you earn a lot against the months where you don't earn as much, and knowing that income can be lumpy sometimes, that's been a bit of a surprise getting used to, especially if it's somebody that likes to budget strictly. So that's been one of the big learning curves, being self-employed and learning to manage your finances, to balance things out when you have really good pay or when your pay is much lower than what you usually get. One of the things I've found which has really helped me to become more efficient and effective with certain procedures has been, number one, not avoiding them. You can start to avoid certain procedures, refer them on, and you never really get to improve at those procedures. So, being confident enough to practice and try certain procedures, especially if you've got somebody who can mentor you and oversee whatever procedures are that maybe you're not used to doing. So not shying away from procedures, that really helps you in developing certain skills. And what I found as well is dentists, we love going on courses. So just making sure that whatever courses you go on, you're able to implement the skills you learn immediately. That Monday that you're back in work, you're able to implement the skills you learned from a course. So being intentional about the courses you go on, so that you can apply those skills learned as soon as you can. And that means that you're not then losing that knowledge over time because you've never applied it. I think from my experience so far, communication courses are essential within dentistry, because I think poor communication will cause you to have a short career within dentistry and an unpleasant experience of dentistry. So I'd say communication courses are key within dentistry, and courses which go over things that you might think of as the basics: treatment planning, how to set fees, because these are things that we never learn at dental school. So these are the types of courses I definitely encourage. Communication, courses to do with fee setting, and courses that go over treatment planning and making sure that you've thoroughly examined the patient. In dentistry, you can earn very well, and the average dentist will earn quite well in comparison to their peers at that sort of age or skill level. So dentistry pays well. The issue becomes, how you manage your finances. So you can get used to a certain level of income and your lifestyle might match up to that income. The problem comes when your income drops because pay in dentistry, as a self-employed dentist, can be lumpy. So if your income matches with your outgoings and there's no, wiggle room there, what happens when the pandemic happens, or if your pay decreases for whatever reason, not as many private treatments are going through, you're injured, and you're having to survive on your income protection. What happens in those cases? And that's where stress comes in for some dentists, because you get used to a certain lifestyle, but to maintain that lifestyle, things have to be going well at work. So my advice would be to make sure that you have a good amount of savings where you could go 3 to 6 months without getting paid and still be okay. And to make sure that you're also investing some of your money for the future, thinking about retirement, pension, because you won't always be able to work as quickly as you can now as a dentist. When you're much older, you're going to slow down. You're not going to be able to work 6 days a week forever. So it's just about making that realization and adjusting accordingly to that. With dentistry, you can work as little or as much as you want to. When I first started, I was working 6 days a week on some weeks, and I was working across 3 different practices. And at that time, I was maybe 1 or 2 years into being married, and I found that worked okay because my wife, working in the NHS as a doctor, her hours were crazy. So it meant that we understood the situation, and the times that we could have together, we did spend that quality time together. But as things have gone on, I got to a point where I wanted to have more free time to do other things. So I decided to drop down to working 4 clinical days a week, and that was great. That really made me realize that you can get so sucked into dentistry that you don't get to experience other things in life. I was able to pursue other interests, working 4 clinical days a week, and income wasn't affected much at all. So that was really good for me to experience and see. Since then, had a baby, had a child, so thinking about things like nursery, and there's other plans that I want to bring into reality. So I'm having to go again to that place where I'm working 6 days a week, 5 days a week, 6 days a week on some weeks. So it's all about finding the balance that works for the season that you're in, but not being in a permanent state of always working that you don't get to enjoy quality time with family, friends, and your loved ones. So I'd say balance. There's no perfect balance. All you can do is manage things with whatever season you're in at that moment. So in dentistry, it's an interesting one because you get paid by the activity and the level of treatments you're providing. But sometimes you can get busy unnecessarily. So one example is you as the dentist, let's say if you're providing aligners, Invisalign for example, you can be doing the video consultations, you can be doing the photographs for that patient, you can be doing the scans for that patient, you can be doing everything, all the steps for that patient, and you can be really busy, but it might not be the most effective way of you working. For example, one of the things that I do is I've trained up my nurse to be able to take scans. She takes photographs, so I don't need to be the person that's taking scans and photographs. That can be delegated to my nurse, and that gets my nurse involved as well in more of the treatments that I'm providing. So I don't need to do everything. I can do less things, delegate some things, and be earning the same, if not even more, whilst having more free time as well. So I find that as dentists, you have to learn the skill of delegating and working efficiently in order to really enjoy your career and do more.